We'll be doing them in some of the locations in Northeast Mississippi. So today we'll be in Clay County, tomorrow on Tuesday in Calhoun County, Wednesday in Webster County, Thursday in Winston County, and Friday in Lee County. So this week, these are the locations that we're going to be offering free rapid tests at our drive-through clinics in Mississippi. Just to repeat it, in Hinds County at the Old Farmers Market, and then today, Clay County, tomorrow, Calhoun, Wednesday, Webster, Thursday, Winston, and Friday, Lee County. This is our first implementation of using the rapid tests that we received from the federal government. These are the Buy Next Now kits, and I'll just show you. We have them here, and I'm not going to do it, but this is the card test. You can see here, and you get a nasal sample and use some chemicals, and you leave it in there for 15 minutes. It'll give you an indicator of whether it's positive or negative. We've had a chance to use quite a few of these, and we'll be reporting out on our results as we go through this process. We anticipate next week we'll be offering this free rapid testing at all of our community drive-through testing locations, but for this week we're rolling it out only in those locations. As far as the utilization of these rapid test kits, certainly we're following the governor's prerogative to really focus on K-12, and we'll make sure it's available for individuals in K-12 working on distribution and utilization plan, but surely we'll continue to offer it at these drive-through locations, and as you're well aware, K-12 students and teachers are priority testing individuals at those drive-throughs. So we encourage everyone to take advantage of that. In addition, one of our other priority groups is for older folks and long-term care settings that don't already have access to rapid regular testing. So we're in the process of developing deployment plans so that we can test that. And so the other thing that we need to talk about is offering free masks and shields. So for people who are going to voting, we know that there will be vulnerable people who will be going to the polls, and to provide some added protection, we will be giving away surgical masks, a little bit more healthcare quality, along with the face shield, so that people are voting. If you have a chronic medical condition or over 65, we will have free masks with a face shield available for you so that you can vote and be safer in your voting process. The individuals that will be eligible to receive the free mask will be those over 65 years of age, those with diabetes, hypertension, cardiovascular disease, renal failure, obesity, weakened immune system, or chronic lung disease. These are conditions we know that increase the risk of severe illness or death from coronavirus. So if you have any of these conditions, and certainly restate at 65 or older, please come in. We will have them at the drive-through locations for the various places where we're doing the drive-through testing. You can come by and just pick up a mask if you have any of these conditions. So please look on our website, find the locations, and go in to receive your mask. The other thing, just want to talk about real quickly, certainly Halloween is much on our mind, and we're still continuing to look at it. CDC does have some guidance that is available. I encourage you to look at that as well, for certain. And then also the American Academy of Pediatrics has some guidelines. I think those are good starting documents. We will also probably put out something that complements these guidelines. But certainly the same principles that are safe for other settings are going to be safe in the Halloween setting. Maintaining distance, wearing a mask, keeping small groups. Certainly would encourage people to have much more modest Halloween plans along with the CDC guidelines than we might in previous years. And certainly it's very okay to not do a traditional sort of trick-or-treating sort of scenario anyway, because we know the risk is out there, especially for kids who live with people who might be in a vulnerable age group or vulnerable with chronic medical conditions. And certainly with the fair going on, I encourage everyone to be careful and safe, hand hygiene, and to wear masks as much as possible throughout their stay at the fair. And then the only last thing is it's time to get your flu shot if you haven't had one yet. It's very important for people to go ahead and get the flu shot. CDC recommends the influenza vaccine for everyone essentially over 6 months of age. And by the end of October is kind of like the deadline for getting it in time, getting ready for the flu season. So go ahead and do it. Not that you can't get it later, but we do strongly encourage people to go ahead and get the flu vaccine. I'm going to go ahead and.
Did you talk about increased hospitalization?
Yeah. And also, I wanted to see if Dr. Byers wanted to add anything. Dr. Byers, if you want to unmute yourself.
Hey, thank you, Dr. Dobbs. Yeah, just to remind folks that, one of the things that we talked about as we moved through the summer months was that we were beginning to see more cases in the younger age groups, especially in the college age kids and younger. And I just want to remind everybody that we are also seeing a lot of cases in the older groups, especially those individuals age 50 to 64 years of age. And so, we don't want you to focus on an age group and think that if you're in one particular age group that you're more protected or less likely to become infected, because we haven't seen a lot of infections in that group. I think we need to stay the course across the board. We know that a lot of the measures that we put in place over the summer worked. We really drove our case numbers down with simple things like using a mask and staying more than 6 feet apart, limiting your gatherings. And I think if we continue to do things like that, we're gonna, we can bend that curve back down to where we want it and more manageable to not only limit the number of cases, but also to protect our healthcare capacity and limit the impact on those vulnerable individuals, especially in long-term care settings.
Yeah, so I do see we have I'll go and start answering some questions now. We see one from Anita Lee, and I'll just read it out. From a public health epidemiological perspective, what accounts for increased transmission and where are the hotspots? I think some of it's not surprising. We're still seeing it in younger folks. That's not remotely surprising. We know that the younger age group is going to be at high risk, certainly more sociable type behaviors. It's social events that tend to be our biggest vulnerability. We're also seeing, around weddings and that sort of thing. So anytime you're social and letting your guard down, we're seeing more and more cases. There are some locations, I know that Forest and Lamar are seeing pretty significant increases over the past week, and all that stuff's on our website on our county profile, and certainly want you to look at those things. And Dr. Byers, would you like to add something on what you see going on with the different transmission trends?
I think what we're seeing is a number of counties throughout the state where we're starting to see increases or are starting to see them on the plus side of those numbers of cases if we look over a 1 week and a 2 week trend. And I think that's just another indicator that we're also starting to see community transmission. Not all of the cases that we're seeing now are necessarily tied to an event or a cluster or an outbreak, but in fact, we're starting to see, the same type of transmission we saw before. We are seeing, some isolated clusters still around colleges and universities, and certainly, we've worked with K-12 schools throughout the state around a number of clusters and outbreaks that have occurred in different settings within the schools. And so, I think we're just seeing a broader community transmission. And when we see that, we start to identify more clusters associated with that.
I see another question. As our numbers from Melissa, as our numbers are slowly creeping up, is this a direct effect of the statewide mask mandate no longer being in effect? We started seeing numbers starting to creep up before really there would have been a potential impact from the mask mandate. I will say, though, that it certainly could be starting to be part of the problem as time goes forward. I will say personally, I've been a little bit disappointed just hearing from churches and businesses that they feel like they're no longer empowered to have their members or visitors wear masks. And I think that does increase risks, unfortunately. I mean, there are a lot of elements to it. Certainly we all have our individual choices, but as organizations, religious or otherwise, certainly would encourage you guys to do it for the safety of your parishioners or your employees. And certainly some groups still need to wear masks. In some places we're doing pretty well, in some places we're not. So just really encourage everybody to do it. Certainly I know that we may head back to having more and more mandatory masks if we can't do it voluntarily. So if we could do things voluntarily, I think that just makes so much more sense. Yeah, and then another question, you mentioned 6 hospitals at ICU capacity. Can you tell which hospitals? I don't have it in front of me, but on our website, we do on a daily basis. So please feel free to go there and look and see which hospitals have capacity or running tight. I think it's just more of a, an indicator that we are starting to see some increased hospitalizations. And I'll just tell you, I do have sort of like also a network of people who just kind of keep me informed what they're seeing in the ERs and the hospitals. And they're all over the weekend were telling me, hey, it's starting to creep up. We're getting busy. We don't have space. We're seeing more patients show up in the ER with COVID-like symptoms. So I do think we're on the front end of something that could be bad. Another question from Kobe Vance. This summer before the statewide mandate, counties were closely monitored and mandates were issued based on those counties by county numbers. Is this best way to approach the mask mandate now, or would it be more beneficial to go directly back to statewide? I'm not sure. There are a lot of elements that go into that. I suspect that more targeted might be the way that we would look at it again. I mean, of course, the governor's the boss, all that, but we'll try to make sure he has the best information available to make the best decisions, and understanding sometimes the mindset of folks and how they can best react. We just really want everybody to wear a mask in public for yourself and also for the people you love. It's really kind of baffling why it's such a big deal. It's such an easy thing, and it adds benefit to our safety and allows us to keep schools open, allows us to keep hospitals from overflowing, allows us to visit people in nursing homes. It's just mind-boggling why it's become such an unnecessary controversy.
And I would also say, Dr. Dobbs, that counties and municipalities don't need to wait for a specific mandate. You can elect as an individual to go ahead and wear your mask, and that's what we need folks to be doing.
And then from Erica Hensley, we have a question. Can you remind us about requirements for school reporting? Are schools still required to report to MSTH per your orders? And what are the consequences for schools that don't? Still seems to be confusion on some certain schools that don't report. Yeah, no, it is required to report. There have been some that have not been able to report regularly. Some of them have just gotten behind, and certainly we'll continue to work with those guys. And, some of the schools haven't really gotten on board yet. We're going to see what we can do to support that. I mean, it's a public health order, and by statute, it actually has a fine and can even be considered, a significant crime. But of course, we want to be more collaborative and make sure that people understand the benefit of it and work to understand the barriers so that we can work with them to kind of overcome those.
And we have teams in all parts of the state that are designated to work with the schools, and we do school outreach through our teams to not only encourage reporting, but to help facilitate that reporting and help with an understanding of what needs to be reported and the time frame.
And then we have a question from Alyssa Zhu. As we know, minorities, including African Americans, Latinos, have been disproportionately impacted by COVID. Can you talk about the health department's outreach efforts to these communities with either health education campaigns or testing? Yeah, we've been very active, and certainly from early in March when we realized that that it wasn't really affecting the people we were most concerned about. It was hitting African Americans and in Hispanic folks and in Native Americans too. And certainly we've worked very closely with leaders from all those communities. We do have a robust health equity response, and actually there's a whole branch of our response that's devoted to health equity under Dr. Victor Sutton and his group. He's done fantastic work for us with Jackson Heart Study and other outreach efforts.
We've had 2 media campaigns.
Yeah, we've had 2 separate media campaigns directed towards African Americans and vulnerable groups. We've been working with Hispanic groups, faith-based communities, a whole lot. We've offered masks and also testing specifically to highly affected groups. And as part of our rapid testing initiative, we will anticipate that we'll make sure that part of our focus is going to be in disparity communities or minority communities, and that'll also extend to our vaccination outreach effort. Encourage you to look at our stuff. The Jackson Heart Study is part of the Department of Health, and they've done some cool stuff also. Another question is from Alex Rozier. Why did testing numbers move to a weekly basis? Will it become more frequent at any point? We get those in big lumps. I mean, we get them like 10,000 on Monday and then none for 2 days and 20,000 on Thursday. It's too lumpy, and it really didn't make any sense to try to push it out every day. We're not planning on releasing it more than weekly. I will say too that, this is one of those things that doesn't give us meaningful data to share with you on a daily basis because it doesn't give me information, but it does pull needed resources away from other valuable reporting that we can do, kind of like these county profiles. I think those things are so much more valuable, or the hospital profiles, than us devoting resources to some reporting thing that really on a day-to-day basis is really just doesn't give you any useful information. Paul, did you want anything to that?
No, I think you're right on with that, and we were just seeing so many wide variations in the daily numbers that we would actually receive from reporters that it just makes more sense for us to do it as a weekly report.
We do have another question is, what do you think about Lamar County sending all pre-K and fifth graders back to school without options for virtual classes? Certainly having virtual option is a great benefit. I'm not sure what their situation is specifically. I do know that some of the school systems had just really such a small number of kids doing virtual. It seemed like it was not really much bang for your buck. And I don't know if there's an educational issue with that. Maybe they're worried about some disparity. But on the school situation, I would like to say that going to in-person class can be done quite safely. And as we look at our outbreaks and our different cases we've seen, in the structured classroom setting where kids are wearing masks, that seems to be a very safe environment, especially if you can separate them out 6 feet or more. If we look at unstructured settings, whether it's athletics or some other extracurricular activity, and then social stuff, absolutely, those are where our greatest risks are. So I think it's good for us to really keep in mind our education mission as a state, whether you're a public, private school, because that's really what we can do most safely. And in some ways, we may be undermining our education mission by an overemphasis on athletics and some other things. Paul, anything you wanted to add to that? From Cubby Vance, do you believe this could be the start of a second wave of the coronavirus here in Mississippi? And if so, do you anticipate it being worse or better than what we had this summer? Yeah, I'm actually very concerned that this is, we're going into a phase. I mean, it's kind of like reading the stock market. Sometimes you don't really know what's going to happen, but we do have some indicators, right? And all the indicators are looking in the wrong direction. We have hospitalizations are up, cases are up, deaths are not really up so much, but we always know that lags. And we know that our COVID-like illness indicators are up. So the last time we saw that was before the summer surge. So it is a worrisome indicator, but it doesn't mean we can't turn it around. It's just a matter of what we choose to do. And hopefully we'll choose to do the right stuff, because it's not that hard. We just have to have a little bit of patience and just restrict some of the things we do. Can you walk us through what someone could expect to experience with rapid testing when they're at a community testing site? Yeah, you bet. So if someone wants to get a rapid test, please go onto our website and look at the testing location, and then it'll take you to a portal where you can either get an appointment by phone or you can do it online, and then it'll ask you some symptoms. Right now, for our community testing, we're really prioritizing K-12, college, childcare, anybody who's been exposed or think you might be exposed, and symptoms. And then if you come in to get a test, what you'll do, you'll go through the drive-through, and you don't have to get a rapid. You can just get a PCR if you prefer it, but we have the rapid available, and we'd like to give you the rapid, and then we do need the PCR for certain. And so, and then you would get your test. It's going to be in the front of the nose. It's not the deep one. It's just kind of in the front. And I think I did, maybe personally, I did 5 or 6 of them today, and people don't really mind it. And then within 15 minutes, you'll know the results of the rapid. What our initial experience has been is if someone does have symptoms and they have coronavirus, it looks like it works pretty well. We have had some people who were exposed but not symptomatic, and they had a negative rapid and a positive PCR. So we're still working out our algorithms of when it's most useful to use the rapid test, this rapid card, and it's almost certainly going to be for people who have symptoms. And then you wait for 15 minutes and you get your result, and then we'll give you a piece of paper that says you're positive or negative. And if you're positive, we'll give you instructions about what to do. And then later on, you can get your PCR results like normal through the mechanism to explain at the drive-through. Michaela Morris, what kind of rapid test will MSDH be using, and what has been the false negative rate? We're going to be using these Binax cards. Where did I put it? Did I put it back in here? We're going to be using the Binax Now Rapid Antigen card right here. Now, and as far as the false negative rate, right now, we don't have enough data to speak to it, but we just know that it could be substantial in people who don't have symptoms, and that's why we're going to collect more information and continue to get information from other partners and federal sources. Is there a current treatment for COVID-19, therapeutic or antiviral, that is proven to be more effective than others in Mississippi? I don't know about Mississippi specifically, but there is some growing evidence that remdesivir actually works quite well if you treat people early in the illness once the oxygen requirement is there. So I think that one looks pretty strong. And then also the use of steroids, especially dexamethasone for people who are at a severe stage of illness, not early on. It actually might be harmful early on, but once people start getting very ill in that sort of secondary inflammatory phase, that's very useful. Those are the things that have been shown to work. There's some other things, you know, the Regeneron stuff, we'll be looking at that. I mean, that's certainly under investigation. I don't know that anyone's taken it in Mississippi. And then there still is no evidence that hydroxychloroquine doesn't seem to show any benefit. And, you know, I think the convalescent plasma piece is still sort of an unknown. Lauren Walk, can we get a photo sent out of that mask and shield? Yes, you bet, absolutely. So I'm gonna give it to my communications director and have her send you guys a copy. And here's a picture of it again. I'll back up maybe so it's not quite so forgive the glare. There you go.
You want me to take this too?
Yeah, sure. Yeah, so we'll do that. Are there some clinical trials? Oh, sorry, Melissa, are there some clinical trials going on here in Mississippi, and how are they faring? There are some clinical trials going on in Mississippi in Hattiesburg through the Hattiesburg Clinic, and I think Forest General together, they are doing the Moderna vaccine, and certainly if you want to be involved, would encourage you to call them. I do believe UMC may be part of a trial soon. I've heard some rumblings about it, but I haven't heard any announcements. But those are the only two I've heard about, but I do know the Hattiesburg one is operational. And I don't know how they're faring. You know, that stuff is really sort of, you know, tight, top secret. They keep the information to themselves so that they don't get any interference or bias. All right, so
Ask if there's any last questions.
yeah, that's all the questions I have right now. Any last questions? All right, well, I'll give you 10 seconds, just to make sure there's nobody else.
What is
Contact
your-
tracing. Yes, we are doing it. It's going well. We've contracted another 100 folks to join us, and I think we're pretty much at 100% contact tracing. Dr. Byers, you want to give us an update on that? I mean, 100% effort. Like, you know, we are unable to reach everybody, right?
Right. So y'all may remember that that periodic times we've had to be more focused in our contact tracing efforts and our case investigation efforts. Just because over the summer, you know, we had so many cases coming in every day. Right now, we do have, with the additional staff, you know, it's our goal to reach out to every case, identify their close contacts, make sure those contacts know that they have to quarantine, make sure the cases know they have to isolate until they're no longer infectious, talk to the contacts about where they can go get tested, because we do recommend that. And so, you know, we're going along pretty well right now in reaching out to folks, and again, with our goal of reaching everybody. But, you know, we'll have to hang on and see how that plays out if we start having big increases like we did over the summer.
We have a couple of new questions come in. Michaela Morris, is there enough data to do good per capita comparisons between states? Yeah, probably, especially mortality. You know, those indicators are usually pretty good because, you know, you can compare state to state, because that's going to be obviously something that's that is, it's hard to miss, right? But as far as, when we have pretty widespread availability of testing like we have throughout the country right now, I mean, there's an overcapacity of testing in Mississippi right now, to be honest, and which is a great thing, right? I mean, you can get tested, and even our testing locations, we have a lot of unused appointments. So I do believe in the setting of, widely available testing that probably the per capita comparisons are reasonable. Lee County, from Taylor Vance. Lee County has seen an uptick in COVID cases recently. What do you attribute this to, and what can be done to contain the uptick? We've been watching that for a little bit. I don't know that there's anything sort of specific about that that's unique, other than just community transmission has kind of been up in that area. Paul, anything to add to that one?
No, I mean, it's basically the same story that we see everywhere. Periodically, we will have an outbreak or a cluster with enough cases in a particular county to really influence the case numbers and cause sort of an uptick. But under most circumstances, when we start seeing increases in a county, it's because we're starting to see community transmission. It's nothing mystical. It's the fact that we see more people being infected and more people transmitting. If you think about the way that the virus is transmitted person to person through close interaction, it's not surprising that periodically we're gonna see some upswings in the number of cases. Remember that even in the counties where we're not having a lot of activity right now, that doesn't mean that there's no COVID there. And at any point in time, all it takes is just a handful of people getting together, and suddenly we have maybe a super spreader event, and we have a lot of transmission again. And that's kind of how it's played out, really off and on through the whole pandemic so far.
Thank you, Dr. Byers. We do have a question from Kobe Vance. So you mentioned during the Mississippi Medical Association Facebook Live on Friday that you were asking hospitals to voluntarily cut back on elective procedures. Have any hospitals begun doing that? And so the first part of that is, there are certain procedures that require hospitalizations and certain that don't. What we're encouraging hospitals to do is manage their own capacity in a way that helps them take care of their patients, but maybe can sort of balance the demands on hospital beds and ICU beds. Each hospital knows their own situation more than others as far as where they are in capacity and certainly staffing and that sort of thing. So this is something that they know how to do, and if they can go ahead and be conscientious, so we don't have to have any sort of interventions from the state level, because we want for them to be able to manage their own affairs without any sort of oversight. So, and the other one says, and the 6 hospitals with 0 ICU capacity, what are the chances of another order to stop some elective procedures? The ICU capacity thing, it kind of comes and goes between different locations. So it's hard to really say if there's something specific about those hospitals. They're actually, I do remember they're in different parts of the state. Some are central, some are north, some are south. So, that's just some variability, but I think it's something for them to watch. And I don't see any chances of any sort of elective restrictions in the near future. And I would like to just reiterate that over the summer, the only electives that were restricted were for electives that required overnight hospitalization, because a lot of things don't require any hospitalization, or at some point if hospitals, the second part was if hospitals got where they could not maintain ICU capacity, then they needed to look at doing that. So, but we want hospitals and health systems to manage their own affairs. Yeah, so I think that's all we have. Thank you guys so much for let's see, there's another one from Taylor Vance. To follow up from my previous question about Lee County, would you advise local officials to act any new mandates or would you simply advise people to simply adhere to CDC recommendations? I'm always happy to see a county or a city take initiative for non-pharmaceutical interventions, and that's stuff that keeps people from spreading it to another. So not a bad idea to have local mask ordinances, not a bad idea to look at crowd sizes and that sort of thing. I mean, those are the things that are really getting us it's indoor stuff with people who aren't wearing masks. And some of the stuff that we've seen, which I thought was really great. I know, like in Oxford, the mayor work to have more outdoor dining. Fantastic. Let's find a way that we can live, but live more safely, because I know people want to do stuff, but if we can find innovative ways to keep people from being in large groups indoors without masks, that's fantastic. To what degree is MSTH from Nick Juden, to what degree is MSTH expecting the flu season to reduce hospital capacity in the coming months? It's really hard to say. There's a lot of factors involved with that. Some of it depends upon what strain of flu we have, and if it's an H1N1 or H3N2. And Dr. Byers, we don't have any indication of that yet, do we?
No, we don't. It's still so early in the season, and we haven't seen really any uptick in our flu surveillance that shows we're having a lot of flu yet. But those are the things we're going to be looking for, is what type of flu is spreading and causing illness, and when we start seeing flu jump up. I tell you, one of the things we've seen from some of the other countries that have already experienced the flu season is that the flu season was somewhat dampened, and in large part because of the measures that have been put in place to try to prevent COVID transmission, wearing a mask and avoiding those large groups, and staying 6 feet or more away. And I think over the summer in the U.S., there was actually less flu identified as well. And, flu, we think about flu as seasonal, but it is, but we have flu throughout the year. And so we actually have less of it in the summer. And again, I think that's in large part because of the measures that people are putting in place. So we hope that blunts the flu season and helps salvage the healthcare capacity.
And then we have another, Michaela Morris, any clusters associated with football games? Well, with football teams in youth sports, I mean, they're almost uncountable. I mean, we've had so many, Paul.
Yeah, we've had a number of clusters associated with the football teams, for sure. I don't know that we've traced any back to clusters or outbreaks from folks sitting in the stands. I know that there's been a mention of that on a few of the cases, but we haven't seen any significant or consistent clusters that I'm aware of. It's mostly been in the teams themselves.
Do we have an update on excess deaths? Yeah, this is from Nick Juden. We do an update every week. So go on our website and look. It looked like our excess deaths were starting to get worse again. From COVID and also from all-cause mortality. So, just to reiterate, coronavirus is absolutely killing people. Please don't listen to the silliness, about, it's not coronavirus killing people. And if you ask anybody who works in a hospital or ICU, they would be so angry to hear that, because they're having to sit with the families while people are dying from coronavirus day in, day out. And my wife runs an ICU, and she sees it every day. The struggles that we're going through. So, but yeah, go to our website and you can see the excess deaths. We're trying to get as much good information like that out for you guys on a regular basis.
And when you look at the data that we have on our website about the deaths by date of death as well, and if you look at our case numbers, and you can see that they're starting to trend upwards, but usually with the deaths, there's a lag between when we start seeing the case numbers go up. So it's certainly plausible that we'll start seeing some increases in our deaths as well.
Well, I guess we'll go ahead and start wrapping up. Thank you, everybody, for your time. Just as a reminder, please do the things we know that work. A small group space and wearing the mask makes such a big difference, especially going into the flu season. It'll also prevent people getting influenza. So, that's a good thing too. So anyway, y'all be safe and look forward to communicating with you guys again soon. Thank you.